welcome back to NED Talks. Today I am joined by Kieran MacPhail, who is a member of the NED Expert Review Panel and a BANT registered nutritional therapist, as well as an HCPC physiotherapist. So Kieran works routinely with people in chronic pain, so is in a great position to share some insights on the paper we're discussing today, which is a double-blinded, randomised controlled trial looking at altering omega-3 and omega-6 levels through diet in relation to impacts on migraine headaches. So welcome, Kieran, and thank you for joining us on the NED Talks platform.
Thanks, Claire.
So, Kieran, could you give us some background on what the researchers were aiming to achieve in this, writing in this paper before giving us some of your key takeaways for nutritional therapy practice, as well as those that are suffering with migraine headaches?
Yeah, of course. So these researchers really were looking at, obviously, whether you can modify the diet in terms of omega-3s and omega-6 intake and how that influences headache symptoms in these migraine patients. So their main in the paper, the main route they look at impacting things through is the what they term the oxylipins, which includes eicosanoids, prostaglandins, leukotrienes, and resolvins and myrcins. Those are the main groups they look at. And in particular, they cite research showing that omega-6 derived oxylipins can provoke migraine symptoms, whereas we know omega-3 derived oxylipins can actually reduce some symptoms and tend to have an anti-nociceptive effect. And we know this in other research. There's work I've cited which shows that omega-3 intake is correlated with patients having reduced symptoms in other areas such as in the neck and the back. And we know that these do have a direct impact on nociception. And there could also be impacts through systemic inflammation, with many parts of the immune system directly interacting with nociceptors and lowering pain sensitivity. So there's multiple mechanisms that could be at play, but the main one they were focusing on was that sort of very large group of oxylipins. So that was kind of their main route they were looking to have an impact through. There's really interesting quality of work, and that they managed to provide such, 2/3 of the diets were provided to a very large number of patients, 182 patients. And whilst they had to find 1/3 of the foods themselves, they were given quite good guidelines, it seems, from direct handouts, as well as supposedly fairly regular calls as needed with any access to a nutritionist. So they did have some, I think it was a dietitian, to be correct. They did have some access to getting information to carry out what they wanted to do. So in terms of the study findings, they basically found both the omega-3, so they had 3 different categories: a high omega-3 diet, which had relatively sort of normal, but I think it was 7% of the diet coming from omega-6s, or less than up to 7% in terms of calories. And then there was a diet which was much lower. So the high diet was 1.5 grams of omega-3s per day from EPA and DHA. Whereas then there was also a diet which had high omega-3 and low omega-6, and another which was kept a relatively normal amount, so 7% by calories is their standard amount from omega-6s, but had much lower amounts of omega-3s. And so what they basically found was the 2 higher omega-3 diets generally helped across most of the symptom scores, but in particular, the higher omega-3 diet compared with lower omega-6s seemed to outperform the other diet across some measures. So for us as practitioners, I think the main thing is, one, we need to be looking at making sure we're looking at omega-3 and omega-6 levels and assessing where possible. And then we can actually, these can be modified, and patients can actually stick to this when they have some level of support. So it's a very practical area that we can directly help patients in pain with. I think one of the kind of key takeaways for me is looking at the levels of omega-3s, and sort of 1.5 grams from EPA and DHA is very, very easily achievable, and it will be interesting to see further work, particularly one thing that always troubles me with these sort of large groups is you have someone like myself who might be close to 90 kilos and someone like yourself that might be close to 50 kilos. And the studies would generally provide sort of the same amount for everybody. And potentially some of us would probably do better with much larger amounts and others with smaller amounts before you get into sort of overly individualizing things, which a lot of people would like to do a lot more than they do in these studies. But it's a paper that gives us, it's not often you read papers where you get a very clear result, something that's very practical that you can actually use and you can immediately take away and apply with patients. And we probably all know someone who has migraines who would probably benefit from a very, very easy change and getting more. I probably don't need to tell the audience where they can get the omega-3s and omega-6s from, but it's very easy to get your omega-3s from the diet, and if not, then supplements, at least in the short term, are very easy to do.
Yeah, no, super interesting. And I think it is also fairly rare, isn't it, that these randomized controlled trials are done using food and controlled diets. I mean, often they would be tested using supplementation. So I think this is amazing that it's actually been done through changing people's diets. And in a way, as you say, with a little bit of support, which BANT registered nutritional therapists are offering across the country, then this is very achievable. And for something that does impact on the quality of life in the way that a migraine headache does, this is fantastic. So yeah, fantastic. Well, that's great, Kieran. Thank you so much. Super interesting and great to hear your insights and the benefits of your experience. So for any of you listening, you can read all about Kieran and how to connect with him on the Nutrition Evidence Database by clicking on the Expert Reviewer tab. And you can access the full expert review, which we're viewing here, that Kieran has written on the Nutrition Evidence Database. So thank you so much for listening to this NED Talk, brought to you by the Nutrition Evidence editorial team in partnership with BANT.